Hi Melanie, how are you doing today?
I'm doing good.
Okay, well I'm Drew, and I'm going to be talking to you a little bit about your pre-participation screening based off of the ACSM. So first of all, can you tell me a little about yourself?
Yes, I'm 21 years old and I play in the soccer team.
Okay.
I also smoke, and recently my dad, he underwent coronary bypass
Okay.
surgery at the age of 49. My mom is 47 years old and she has type 1 diabetes. For my exercise, I do resistance training 4 times per week with the soccer team. I also cycle to and from school for half an hour and like 10 miles, several times a week, like 6 days. And I also like to play basketball occasionally with my friends. So.
Okay. Awesome. Well, thank you for your background information. I'm going to just be asking you a couple more in-depth questions just to get a better understanding. Okay, so please answer as honest as possible and as well to your knowledge. Has your doctor ever said that you have a heart condition or a high blood pressure?
No.
Okay. Do you feel pain in your chest at rest during your daily activities of living or when you do any type of physical activity?
No.
Okay. Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
No.
Okay. Have you ever been diagnosed with another chronic medical condition other than a heart disease or high blood pressure?
No.
Okay. Are you currently taking prescribed medications for a chronic medical condition?
No.
Okay. Do you currently have or have had within the past 12 months a bone, joint, or soft tissue, such as muscle, ligament, or tendon problem that could be made worse by physical activity?
No.
Okay. And has your doctor ever said that you should do only medical supervised activity?
No.
No? Okay. Thank you. And then I'm just going to ask you a couple more questions. Do you experience any discomfort in your chest, pain in your neck or jaw?
No.
Okay. Do you experience any shortness of breath during rest or mild exertion?
No.
Do you experience any dizziness?
No.
Okay. And then do you have any sensation of breathlessness or shortness of breath that wakens you at night or anything?
No.
Okay. Do you have any swollen ankles or any swollen feet?
No.
No? Okay. And then do you have any cramps in your leg? Usually, like, it happens because of the arteries, but do you ever experience any cramps when you're playing with your soccer team or anything when you're cycling? Okay. Do you have a known heart murmur?
No.
Okay. And do you have any unusual fatigue or shortness of breath with unusual activities throughout your daily life?
No.
No? Okay, awesome. So, a couple of things that I do want to talk to you about. So I don't have any medical clearance for physical activity since you are already like physically active. There are a couple risk factors that you do have that I would like to talk to you about. First of all, though, it's important to keep up your daily active lifestyle, especially given your family history with heart diseases. Your dad just had the coronary bypass, and your mom also has type 1 diabetes. So it's very, very important that you stay active in order to reduce these symptoms or any future susceptibility to these heart conditions, especially because, you know, genetics and things like that. And then you also said that you are a smoker, so, you know, your smoking is going to increase your likelihood of cardiovascular disease and asthma and things of that nature. So that is something to be very well aware of. And your blood glucose levels that I saw in our charts is something that I do want to talk to you about. So it's at a 97, and anything over 100 could be categorized as pre-diabetic, and since your mom does have type 1 diabetes, that is something to be very well aware of because that will change the whole chemistry of your body. So just be aware of that. Maybe, you know, cut down on some sugars, things like that. So you have 2 risk factors. So I would categorize you under a moderate intensity of exercise. And so the moderate intensity is something that is going to noticeably change your heart rate for longer than 10 minutes. It's going to increase that, and it's probably about a 5 or a 6 on a perceived scale, perceived pain scale. And so you want to stay within those, you know, that you don't want to go too over or too low because then you're not going to get any of those benefits. And so since you're doing soccer resistance training 4 times a week, and you're also cycling about 10 miles per 6 days. You are engaging in physical activity, and I would recommend medical clearance to continue that vigorous activity because you have these 2 risk factors, that could be harmful to you. I wouldn't, so what I would recommend is to get that medical clearance to continue your vigorous activities, but maybe within this time period of that you're getting medical clearance, your resistance training, I don't know if you're doing them 4 days in a row or how you're spreading them out, but putting a day in between your resistance training could be really good for your muscles synchronization. Gives them some time to process and grow, things like that, and it's not going to overwork your body. It's really good to take a day off. And you're also doing the cycling 6 days a week, and maybe I would just cut down to 5 or 4, just until you get that medical clearance, and then you can continue back. And that is all that I have. If you have any questions or anything?
No?
No?
It was really clear.
Okay,
Yeah.
awesome. Well, it was very nice to meet
Thank
you.
All right.